Absolutely. So this is an excellent question. And of course, the obvious question for such a presentation is, so how does the future look like and what's the direction? So the simple answer is that we see currently two avenues that are quite interesting. One avenue, of course, is driving this, let's say, direction of finding novel immune modulators that come together in a specific way. The problem here is that you have to find something that is specific in the liver microenvironment, but is not impacting negatively the rest of the body. And this is, of course, a challenge. But we see that there are some interesting molecules around that are in clinical testing and see what the data brings there. But this clearly sort of advances beyond our standard approaches with typically modifying T cell activation, T cell specificity, but moves into the realm of microenvironment modulation. And this is something that is also driven by novel technologies. And one thing that I wanted to sort of point out here is that there are interesting aspects of attacking liver metastases with local ablation technologies. So a physical destruction of the lesions in the liver can at least partially alleviate this problem there. And then the question is, if we have a smart approach for then sort of triggering the immune activation when we have the ablation of the liver metastases before, does that change the playing field? There's some data that shows no, and there are also some really nice clinical trials ongoing that show that there might be an effect, but we still have to see that's ongoing.